We chose the name ArqueDerma. It literally means in Latin to inject the skin. What inspired me mostly to create ArqueDerma was just the patients were happy that we're coming back, but I don't think it was really what they wanted. They would come back and be like, well, can't you do anything to lift this? Or I just think I need a little bit, what can you do to hold this there? And I just felt like I wanted to give that to them, that there was a need out there for something new, something innovative, and something exciting and different that worked.
ArqueDerma is a new technique that uses the fillers that currently exist to create more lift and longer lasting results to the skin when we use it. Specifically, ArqueDerma really does a couple of great things that allow us to get those longer lasting and improved results. And the first thing it does is it creates some space in the tissue, in the skin, that allows us to place columns of filler. Rather than pools of filler, it creates columns. Kind of the same way that you might use a column to hold up a roof or hold up a structure. It's oftentimes fibers that are damaged from years of aging or sun damage. And it causes the body to reabsorb those damaged fibers and replace them with new collagen fibers, oftentimes in a better, more structured order that'll help maintain the volume and maintain the youthful appearance that we get at the end of our procedure for a longer lasting time than we would typically.
When I saw Leslie's technique, it was nothing like I've ever seen, and the results were great. There are definitely areas of the face that have been very hard in the past to address without this technique. Especially the jowls of the mouth. The ArqueDerma technique, you can actually lift it up and actually give them back a good cervical mental angle that they really appreciate. Number one, it makes the filler last so much longer, and it gives such a better result. And again, if you're not putting a ton of filler in there, you're not going to get that marshmallow effect, which nobody wants.
Knowing that there is someone out there that's been injecting for 20 years that could actually learn something new, and this is a completely new concept for them. But we are the only technique that is absolutely meant to strategically lift and relocate areas of tissue that is lax and move it into an area of a hollow. It's very, very unique, and it's very exclusive to the practitioners who are licensed to do this technique. The ArqueDerma Artistic Restoration Lift is really about natural results. That's the key thing. It's being subtle. It's putting things back in a place where they used to be, putting them back to where they were. You may have some extra volume here, and you might be hollow here or here. So what I do is I take that and use the needle and the syringe as my, almost like a liquid glue, and pull it into an area of a hollow, which is actually just going to give you an overall smoothing effect. But I find that most patients that come in actually have plenty of volume to work with. It just needs to be moved in a different location.
So it's kind of a relocation plan. So the tissues that's there, we essentially readjust it and move it to a higher position or a better position, a more youthful position. And then using the benefit of that disruption of the fibers to help the body hold it there for longer. So it really restructures the tissue rather than just filling it in and looking unnatural, and ultimately gives a more natural result that people are very happy with.
And what I like about the ArqueDerma technique, most of all, is it's so fiscally astute. It actually stretches out all the filler that we do use and that they do purchase in the most cost-effective way that you can possibly use it as a cosmetic injector. It's really amazing. The results are just so much better, and they last so much longer with less product than you used to need.
This technique is new, it's patented, and it's exciting, and it's something that everybody's interested in getting involved with. But it does use some very core principles that are very safe. So essentially we're using things that we've always used. Hyaluronic acid, which we've been using for many, many years, is safe and is a part of this new technique. And then in addition, we use a needle, which has been used for years and years for all types of surgery and non-surgical techniques. And now it's just redirected in order to stimulate the collagen, not only in a safe way, but in a beneficial way to get a better result. There are training centers available throughout this country, and also actually training centers opening up in other countries as well. This technique has been so interesting to new practitioners that they've really had a demand to learn it, and so we're trying to quench that thirst by opening new centers for teaching.